Hello, my name is Lorraine and I'm a specialist oncology dietitian at the Christie Hospital. Today I'm going to talk to you about your nutrition. There's a lot of information out there that can be confusing and overwhelming. So we're going to talk about what you can eat, including tips on what you can do if you're struggling with your appetite, having any difficulties eating or are losing weight. We have lots of information that I will refer to during this session that are available online from our Christie website or in the form of a booklet which you can ask for. Hopefully by the end of this you'll have more of an idea on your diet or where to go to get more information. Eating is an important part of everyday life and it's about enjoyment, but it's especially important when undergoing treatment or recovering from surgery and chemotherapy. Your body needs a variety of nutrients from foods, so eating a balanced and varied diet is important to help your body fight infection, cope with any side effects from your surgery or treatment, helping with your recovery and keeping your energy levels up. First, I want to talk to you about a balanced diet. This is if you have a good appetite and your weight is stable. Try to eat 3 meals a day and include snacks as needed. Your diet should include carbohydrates, protein, plus fruit and vegetables. Carbohydrates are our main source of energy, and when eaten regularly can help to maintain energy levels and minimise fatigue. Starchy carbohydrates should be part of each meal time, and these include foods such as bread, chapati, cereals, crackers, rice, pasta, noodles, quinoa, couscous and potatoes. Protein-rich foods are important to help you build muscle and aid with healing of tissues, particularly after surgery. Examples are meat, fish, eggs, beans and lentils, pulses, soya and soya products, tofu and nuts. When choosing meat, lean meat protein sources include chicken and turkey. Red meats such as beef, lamb, pork and goat are all rich in iron and can be beneficial in your diet. If you're vegetarian, good sources of iron can be found in tofu, beans, pulses, dried fruits, mycoprotein and fortified cereals. Milk and dairy products are rich in nutrients, especially protein and calcium. Include regularly foods such as milk, yogurts and cheese, and they're all good choices. If you don't eat dairy products, try and include calcium-fortified plant-based alternatives, which you can see in the supermarkets, and there's a big range there. And choose the varieties with a higher protein content, for example, soya-based products. Fruit and vegetables are good sources of fibre, vitamins, minerals and phytochemicals, which can all help to keep you well and support your immune system. Try to include a variety and a rainbow of colours. These can include fresh, frozen, tinned, dried or juiced fruit. For more detailed information on balanced eating, please refer to the Christie leaflet, Eating Well, Living With and Beyond Cancer. Vegetarian diets, or also known as plant-based diets. There are different types of plant-based diets such as vegan, lacto-ovo vegetarians, ovo-vegetarians, semi-vegetarians and pescatarians. These diets can be nutritious as long as they're balanced to get all your nutrients. It is important to make sure you get sufficient protein, as mentioned before, alongside some of the vitamins and minerals. I will talk to you about some of the vitamins and minerals that you need to try and have enough of. Vitamin B12 is an example, which is for anemia and fatigue. This can be found in fortified breakfast cereals, yeast extract, soya yogurts and non-dairy milks. Try to have fortified foods twice a day. Iron, and this can be found in fortified breakfast cereals, dried fruits, nuts, seeds, eggs, green leafy vegetables and whole grains. Try to have a source of vitamin C with the foods, because this can help you to absorb the iron from your food. Calcium, which is important for bones, is in fortified plant-based dairy alternatives, which you can see on the supermarket shelves, and there's a huge range. Tofu, tahini, nuts, seeds, kidney beans and green leafy vegetables. Selenium can be found from grains, seeds and nuts. And actually having 2 Brazil nuts will give you sufficient selenium for the day. Zinc. This can be found in fermented soya, such as tempeh and miso, beans, whole grains, nuts, seeds and some fortified breakfast cereals. For more information on these diets, you can look at the British Dietetic Association website, and there is a food fact sheet there that you can source. Low fibre diet. If you've been advised to follow a low fibre diet by your doctor or dietitian, your diet will differ from what I've previously spoken about. An example being, you may have to eat white bread instead of whole grain breads and avoiding certain fruit and vegetables. Please ask for a copy of the Christie booklet, Eating Well, when following a low fibre diet for advice on what to eat. Stomas. If you have a stoma, please follow or seek advice from your stoma nurse or dietitian on what to eat if you're experiencing wind or struggling with your output. Hydration. It's really important to keep yourself hydrated, and if you're experiencing problems with diarrhea or struggling to drink enough, please discuss this with your doctor or specialist nurse. You can obtain more information in the Eating Well booklets to support your hydration. There may be times when you struggle to eat or you find that you are losing weight, and therefore you may need to change the balance of foods that you're eating or eat more often. This may be short-term or long-term, depending on your treatment and overall health. Our Eating Help Yourself booklet, which you can obtain from your nurse or online, contains general information and tips to help you to eat well and maintain or support your weight. If you are losing weight or struggling to eat, it's really important you let your doctor, nurse or healthcare professional know. If you have diabetes, please ask for a copy of our booklet, Eating Well with Diabetes, when you have a poor appetite. Making things easy for yourself is really important. Some ideas that you can use are such as using foods that are already prepared for you, such as chopped up fresh or frozen foods like fruit and vegetables. You could try batch cooking and store this in your freezer. Nutritious meals don't have to be hot, home-cooked meals. Try stocking up on a selection of ready-made meals, plus nourishing packet or tinned foods. For example, tinned fish, meat, soups, custard, rice puddings, for those days when cooking or preparing meals may be too difficult or tiring. Use of your local food delivery service is also another suggestion. Nutritional supplements. Sometimes when you're struggling to eat enough with ordinary foods, you may require nutritional supplement drinks or products to support you. Some of these may include milky or juice-based drinks. Please discuss this with your doctor, specialist nurse or dietitian. We also have a booklet available which can give you some ideas, and this is available on our website. You may ask the question, should I be taking a multivitamin and mineral supplement? And the answer would be no if you're eating a varied diet. If you're struggling with your appetite, then it may be helpful to take a standard multivitamin and mineral supplement daily to support you with your diet. With regards to high-dose vitamins, dietary or alternative supplements, there is not enough evidence to suggest that these can help to treat cancer. Some can interact with medicines and treatment, and therefore it's really important that you discuss this with your doctor or your specialist nurse if you're considering taking them. Symptoms. If you're having difficulty with chewing your food or have a sore mouth, you can also ask for a copy of our booklet, Eating a Regular, Easy-to-Chew Diet, which has advice on foods that may be easier for you to eat. If you have a sore mouth, you may find avoiding certain foods until your mouth heals, such as the salty or spicy foods. Sometimes drinking through a straw can also help. There's a lot more tips in our booklet. Some people may experience taste changes from chemotherapy, medication, or the cancer itself. Food and drink can taste differently, so some tips that may help are, firstly, to keep your mouth nice and clean and make sure that you're drinking plenty. A common one is tea and coffee not tasting normal, and so have fruit juices, cordials, milky drinks and Bovril instead. If things taste bland, then try adding more flavours to foods by marinating with pickles or spices, or foods with different temperatures like crumble and ice cream. If meat tastes too metallic, then have more fish, chicken or turkey. If you have any other symptoms, please find tips on how to manage your eating around these side effects in our Eating Help Yourself booklet mentioned previously. There may be some medications to help with some of the side effects, so it's important to let your doctor or nurse know if you're experiencing any of these problems. If you have a food allergy or intolerance, or are on a special diet, it's important that you let your doctor, nurse or healthcare professional know, especially if you're going to be coming into hospital as a day case or as an inpatient, so that we can make sure your nutritional needs are met. Anti-cancer diets. There are a lot of anti-cancer diets out there on the internet and in the media, claiming to help you fight cancer. However, there's no scientific evidence to support these. Often these diets can be very low in energy and other nutrients and can be difficult to follow. If you're considering following one of these diets, please discuss it first with your doctor, specialist nurse or dietitian. And you can find out more information on the Cancer Research UK website. In summary, try to enjoy your food and eat a varied diet. If you experience any difficulties with weight loss, eating or drinking, please see the booklets we've discussed earlier and let your dietitian, doctor or nurse know so that we can help to give you the support that you need at this time. Good nutrition and hydration is important to support you through your treatment and help your recovery.